So this patient's coming in for a rapid growth on his left nostril. It's been developing over the course of the last month. I'm working with Dr. John again today. And Dr. John, what is that?
Pyogenic granuloma.
Yeah, very good. And I kind of stole his thunder. I didn't prompt him with that. He knew right away, and which is a good diagnosis to make. Sometimes people get nervous about this being a cancer. The problem with these is it's had a very big blood supply. Now, remember we talked before about pyogenic granulomas? What could he have done at home that might have helped with this? Remember he mentioning something?
I don't.
So remember there's salt baths? So if he'd been early enough, now this is too far gone, it won't do anything, but if you actually surround them with salt, it's a hypertonic solution, it draws fluid out of them.
Okay.
Same thing, liquid nitrogen can sometimes help, but this is too far gone. So essentially, what's the only challenge this is going to create is where it's at. So I'm going to do a topical freeze, I'm going to spray this, I'm going to cover his nostrils to make sure we don't have him swallow that. And then we're going to have to freeze it. This area is very tender, so that's a hard area to freeze. So hopefully some of the topical freezing helps to a certain extent.
But first, let's check out what you've been missing over on Patreon. For every video that's uploaded to YouTube, there's another one uploaded to Patreon the same day. Today, the video is a hematoma where Dr. Butler releases a lot of pressure for a patient. Some other recent videos include the removal of a foreign body. We also have the drainage of a ganglion cyst. If you're interested in subscribing, it is $4 a month, and the link to that page will be in the caption.
So this is also a little bit cold. Just put one here for me, if you don't mind, Dr. John. So a little cold here. You okay there? Mm-hmm. Sorry as I muffle you and then ask you to speak. You okay there? Did I get some down your...
Just a bit.
Yeah.
What's it taste like?
Nothing yummy. I'm trying to get behind it. Good. Good enough. All right.
Lidocaine.
Yeah, this is the lidocaine here, so I got to get to the base of this, which is right inside his nose. I apologize if you're going to feel a poke. Sorry, poke. Yeah. Going to feel a burning. Yeah. I can just do a little at a time. Very good. Yeah, that is uncomfortable. I gotta make sure there's enough up through here too. Sorry, I feel this again. Sorry. So this I just do very little amounts at a time because this is like really, really intense lancinating pain. So and what am I using right now?
The lidocaine?
Yeah.
I would assume it's lidocaine without epi, given the location. Yeah.
So what are the areas where we don't use epinephrine and why? Sorry, just breathe. I'm just giving you a break.
Yeah.
That should be the end of it.
Areas with a terminal vascular supply.
Right, and artery supply, exactly. And what are those?
There are areas without collateral flow.
Yeah, do you know which ones we look at generally?
Fingers, toes, penis, nose, ears.
Yeah, exactly. Now, having said that, we talked about that before. If you look in the literature, have I ever seen a case where there was actually, organ compromise because of that?
I've seen plastic surgery use them on fingers all the time.
Yeah, that's what I'm saying to you. But in theory, we still don't use that.
Right. And
So
it might have been nice here given the vascular nature of the lesion,
Yeah,
but
exactly.
still probably best not to.
Any pain when I do that?
I feel nothing.
All right, that's the right answer. So essentially, I'm just going to be scraping this.
I'm terribly sorry. Do you have something I can hold?
Oh, yeah, I have some stress balls you can grab.
Even if I don't feel anything, it'll just be...
No. Here, grab this one.
Thank you.
It's not here. So again, we'll see how we do the best we can because this is going to want to run on us.
Is something in my right nostril?
A piece
Just
of
a
gauze.
piece of gauze, yeah. So
It's actually in your left nostril.
Because I feel something in my right nostril and it's weirding me out.
no pain when I do this.
I don't feel anything.
That's the right answer. Grab this here. So this won't conduct unless it's dry, so we have to just expose this slowly. You okay?
Mm-hmm. Well, that's a good smell.
Yeah, it's not a great smell.
That would be your own burning flesh, sir.
That I gathered.
It's not hurting though.
No.
Okay.
No. I just psych myself out sometimes. Oof, felt some heat on that one.
Sorry.
Yeah, and I can add some more freezing depending on the scenario. But this is why this was never going to go away unless we take it off.
Right. Too big.
Yep. Which is too bad if you can recognize it sooner. Sometimes this is what I do find happens. People just get nervous
Yep.
because it's, and we may have to put a stitch in depending on the scenario. I'll see how this progresses.
You okay?
Yeah. Pure psychological distress and wanting it to be over.
No, it's not just that. I mean, this is real. So you're not being a baby or anything like that. Try to see if I can hit it from both sides. But it's not hurting.
There you go.
Just put pressure on that for me, Dr. John. Very good. So he's got some residual tissue here that we're going to have to scrape off.
Okay.
As soon as I can get this to stop bleeding enough to get to it. Just pull his nose that way for me. Yeah, perfect.
Oh, fuck.
That hurt?
Yep, that one hurt.
I apologize for this. It is coming.
That's all that matters.
Thank you. This is going to seem counterintuitive, but now I'm actually going to scrape this. Again, not hurting.
No, just glasses pressing. Oh.
So all I'm trying to do there is just take down the extra part of the
Last
pyogenic
bit of
granuloma that's
tissue.
still there, yeah.
I just know you guys are doing a wonderful job.
It actually is.
It is coming, yeah.
Coming along quite nicely.
Yeah. So the biggest part of this is just realize what you're getting into. So knowing that this was going to do this before we started,
Right.
that's what I was telling you. It's just such a big vascular area. Just put pressure on that again for me. So that we're not surprised by this in terms of an outcome.
Oh,
Hurt again?
not bad, but it just, when anything happens, it catches me off guard.
So just a little bit.
Yeah, just tiny bit.
Okay, let me know if you feel that again. I'm gonna add some more, but hopefully not.
Oh, yeah.
I got this.
That's why you were feeling it, though. There's an area we obviously didn't quite cover as well as we should have.
I apologize for the noise.
No. This is really, really.
You're the
sensitive.
one suffering, man.
Yeah.
Oh, now I taste blood in the back of my mouth.
Yeah. Do you want to swallow? You okay there?
Yeah, I'm good. Just
making sure. Does that hurt at all?
no.
Any pain here?
No.
All right, good. Just tilt the tip of his nose back again for me. Perfect. Still, eh? We can also just use a pack, pressure to do this, but I want to make sure there's bleeding as little as possible. Just going to give you 30 seconds just to make sure that the freezing has a chance to take. I'm going to decrease the gains. Do this just again, see if you feel this is less intense. Does that hurt as much?
No, I don't feel anything. Nothing at all.
Okay, good.
Let me wipe your tip.
Oh yeah.
Sorry.
Oh, you're good. It's not hurting though?
No. Sorry, can you give me 10 seconds?
Yep.
Sorry, I just couldn't breathe there for a second.
Nope. We're almost done.
Okay, you're good.
Okay. These two areas. This is just where we froze. All right. That's it. So we'll just have the nurse who's going to put a pressure dressing on that for you, and then we're going to see you back in about half a week, okay?
Okay.
So this is our follow-up of our patient who had that very painful pyogenic granuloma removed from his nose. This is now just a few days later. It's scabbing over nicely. Doesn't look like there's any tissue that's trying to regrow. We're just going to touch that up very quickly, just with a touch of liquid nitrogen, just to make sure that that's the case, to make sure it heals completely. And then I'll see him back maybe in a few weeks.